High blood pressure occurs when the force pushing against the arterial walls reaches a certain threshold. As this pressure grows, so does the risk of deadly ailments. Fortunately, there are a number of tools at our disposal that can help manage blood pressure. Abbas Kanani, a pharmacist at Chemist Click, explains that some drugs aimed at easing flu-like symptoms could increase your risk of the silent killer. As the cold intensifies, thousands of Britons turn to products to ease congestion, aches, and other flu-like symptoms. Much of the medication aimed at easing colds, allergy, sinusitis, which can often be found combined with non-steroidal anti-inflammatory drugs such as ibuprofen and paracetamol. One of the main ingredients found in these pills is decongestants. The NHS explains, decongestants are a type of medicine that can provide short-term relief for a blocked or stuffy nose, nasal congestion. High blood pressure, the vitamin supplement associated with significant reductions they can help ease the symptoms of conditions such as cold and flu, hay fever and other allergic reactions, catarrh and sinusitis. When someone has a cold, their nose often becomes congested because the body sends extra blood to this area. This causes blood vessels and neighboring tissue to swell. Decongestants are added to drugs to target congestion by reversing this process inside the blood vessels. Don't miss, dementia warning, the 60p ingredient shown to double your risk, informer Nadia Hussain Health. TV chef riddled with health condition, latest, high cholesterol, 3 breakfast foods that can slash your risk, insight, but the drugs target the vessels in the entire body, not just those in the nose. Mr. Kanani explained, decongestants relieve stuffiness and nasal congestion but can cause an increase in blood pressure. Decongestants contained in over-the-counter products used for cold and flu include pseudoephedrine, ephedrine, xylometazoline and oxymetazoline. These ingredients reduce inflammation in the nasal passage and provide relief by narrowing the blood vessels. You will find these ingredients in most over-the-counter products for cold and flu. Physicians also recommend staying alert to products that contain multiple drugs to treat numerous ailments like fever, cough or sore throat. By causing the vessels throughout the body to constrict, these drugs could be particularly harmful to individuals with hypertension. Harvard Health adds, decongestants are also stimulants, which can increase your heart rates or cause anxiety or insomnia. The drugs aren't recommended for people with heart disease, high blood pressure, diabetes or angina. The FDA explains, high blood pressure puts you at risk for heart disease, heart failure and stroke, among other things. The health watchdog says the condition is often dubbed the silent killer because it doesn't produce symptoms. Alongside the aforementioned drugs, other factors such as diet are deemed influential on the risk of hypertension. Regular exercise and reduced salt intake are both recommended to reduce your risk.